About investing in ourselves. In Tobago, there is investment taking place. Specifically, Tobago caregivers are being trained in quality patient care. And we have with us this morning Deenie Solomon, who is the facilitator and district health visitor of the Tobago Regional Health Authority. Deenie, good morning. Deenie, good morning. All right, it appears as though we might be having some technical difficulties. We're not hearing Deenie, so hopefully we can get Deenie back on the line. But in the meantime...
Yeah, I wanna get back to the tide returns. You mentioned it just now, the brand new book that's out, and I definitely want to encourage people to check out Latoya Roberts' work because the story is very compelling. I'm interested. I think I'm gonna go find the book and take a read of it because the idea of bringing that concept of, well, Caribbean romance, we love that.
We love, of course.
But bringing the aspect of climate change into it, where we get an awareness, an acute awareness, because we might see things happening around us. You know, we talk about the shortage of bees, for example. We talk about different things that we've seen happen, and those of us who've been around for a little while, and some people longer than me would be able to say, you know, that they've seen beaches go from one state to whatever it might be now, and it might be a completely different coastline in some cases.
Columbus Bay is one for sure, going down the carcass, definitely. When you speak to the generations previous, they will say, well, you know, before it was like this and now it's completely changed. And that's the thing. I mean, everything is evolving, and it's beautiful to see that our literature is also evolving with it. We're going to see if we can get Deenie back on the line. Deenie, good morning. Can you hear me?
Morning.
Good morning. Welcome to the Now Morning Show. How are you doing today?
I am fine.
So, Deenie, let's talk a little bit about the training in quality patient care. What exactly took place?
Okay, so the TRHA in collaboration, the Division of Health, Social Protection in collaboration with the TRHA, they found that there were a lot of admissions in the A&E department, and that would filter into the medical ward and on the surgical ward, and they found that there were a lot of issues that were preventable with these patients. So they decided that they would come up with a program that would help caregivers, families that are taking care of the elderly, whether it be a child that is a person that may be disabled, to help them to take care of their loved ones or the clients in an agency or a home, and that they would prevent these admissions from coming to the A&E department and clogging the A&E department with issues that can be prevented at home or maybe in the home itself, the home for the aged.
And Deenie, what sessions did you facilitate in this?
Okay, so we had 12 topics because it was 12 months, which is 1 year. And the topics I presented was maintaining skin integrity and patient hygiene. The topics that I did both of them kind of intertwined in terms of the skin and hygiene for the elderly, because you know these would have been persons that would have had their life before actually getting to the point where they have to depend on someone. So we would teach them about skin care, nail care, hair care, how to tidy them, how to care for the skin, the type of lotion, the type of soap to use, how you could ask the persons or the family what the person would have done before being in this state. And so you could understand your clients and understand what they were like and help them to also, during this period or phase of their life, to continue with what they know so that they would not go into a state of depression. Because sometimes when you lose your independence, you go into a state of depression, so that these persons can be, you know, they can prolong their lives so that they can continue, you know, living.
And Deenie, what was the feedback like from the participants in the session?
Oh, they loved the content, the information we provided, the tone that we use, the words or the language that we use, that they could have understood what we were saying, they could have related to what was taught to them. They actually wanted for the program to go on more, you know, for a longer period and stuff like that.
That's always a good sign, you know, when everybody wants to stay on and they're ready to do some more learning, that you have definitely fulfilled your duty. Were there any concerns that were shared by the participants during the sessions?
Oh, yes, because we had one topic per month. Some of them would have missed some topics and wanted to know if we would have done it at a later date. But one of the issues we were having is actually having facilitators to do the different topics. And I have my duty to my community and my district. So I was only able to do 2 of the topics at the time allotted to me, because they would have had other topics for the other month. So I had to advise them, maybe in the next cycle, when we put out the ad out there, that they could register for that topic that they missed, so that they could gain the knowledge on the topic that they wanted. Another thing, that one issue is that some of the persons would have registered for the course, and because of the time frame for the course, that they weren't able to attend because they were at work. So some of them would have liked to be there. They would have liked the time to change, but it's just to accommodate them. Sometimes it would have been an issue for me and work, or any other facilitators with work and stuff like that.
Now, that term that you just used, interesting, because that was going to be my next question to you. If you noticed there were any common concerns or issues that came up among caregivers, particularly in the profession.
Yes, some of them would have challenges with having equipments, so that they could perform the duty or the skill that we would have showed them. So they would have to use an alternative, and we would have to show them. Some of them are creative. They would come up with their idea. They would even teach me how to do stuff without the actual equipment or the resources. Some of them, also the location, sometimes it maybe have been too far for some of them to get there on time, or transportation to get there and stuff like that.
Deenie, what advice do you think is important for caregivers to understand?
Oh my God, to be empathetic. Put yourself in their shoes so you can understand what they are going through. Because it's not easy to have your independence, be able to walk, be able to do things on your own, attend to the daily activities, and now you have to depend on someone. So put yourself in the shoe. What would you have liked somebody to do for you, to eliminate the pain, to eliminate the discomfort they might feel, or to have them feeling comfortable, so that they can understand and provide better care for them, and that they would notice and observe your clients. Also ask the client's relative. If it's not your relative, ask them what the person was like before, what would they have liked, how they would, so that you can understand and provide that care to make them comfortable, and not have them feeling uncomfortable, especially with a stranger in their home, or a stranger taking care of them, because families may have to go to work or attend to other duties. So be caring, love what you do, remember to be kind to these persons.
And Deenie, I'm going to flip the question now into reverse. Any advice for individuals who have caregivers now as a part of their family who are in their homes?
Be kind to your caregivers, because they are also human beings. And if they are there to care for your family, meaning that they would be there during the day, which may be 8 hours or more while you're not there. So sometimes take the time to listen to them, take the time to ask them questions, take the time to ask them what you could do to make them comfortable in your home, so that they would want to come back to actually help your relative, or make your relative comfortable.
Deenie, thank you so much for joining us this morning. It's been a pleasure. Enjoy the rest of your day.
Thank you.
Deenie Solomon, facilitator and district health advisor of the TRHA, with us this morning on the Now Morning Show. Stay tuned. There's more coming up after this break.